Clean these 10 body areas daily to feel stronger and live longer after 65. Introduction. Growing older brings wisdom, memories, and the joy of life's simple pleasures. Yet it also brings unique health challenges. In my 30 years as a general practitioner caring for older adults, I have learned that daily hygiene is far more than just a routine. It is a powerful tool to prevent infection, maintain function, and promote longevity. For seniors over 65, targeted cleansing of specific body areas can reduce the risk of pneumonia, urinary tract infections, skin breakdown, and other conditions that shorten lifespan. Guided by evidence from the World Health Organization, the National Institutes of Health, the American Geriatrics Society, and leading clinical studies, this article explores 10 critical zones that deserve special attention each day. You will discover why each area matters, how to clean it safely, and what health benefits you can expect, presented in clear, compassionate language that respects the experience and dignity of older adults. Let's embark on a journey of gentle, science-backed self-care that honors your resilience and nurtures your future vitality. 1. Hand and nail care, your first line of defense against infection. Hands touch nearly everything: door handles, medical devices, mobility aids, and family members. In seniors, whose immune response is naturally diminished, clean hands markedly reduce the risk of transmitting pathogens that cause respiratory and gastrointestinal infections. A study in the American Journal of Infection Control found that consistent hand washing with soap for 20 seconds removes up to 99% of microbes, including influenza viruses and antibiotic-resistant bacteria. AJIC, 2018. How to clean? Use warm water and fragrance-free, gentle soap. Rub palms, back of hands, between fingers, and under nails for at least 20 seconds. Rinse thoroughly and pat dry with a clean towel. Why it matters: prevents cross-contamination when preparing meals, taking medications, or assisting with personal care. Proper nail trimming and gentle buffing prevent fungal harboring under nail beds. Expert tip: keep a soft nail brushed by the sink. Trim nails straight across and file edges to avoid ingrown nails and painful nail splitting. 2. Oral and denture hygiene, a healthy smile for a healthy heart. Oral health in seniors directly influences cardiovascular, respiratory, and cognitive well-being. Poor denture care or neglected brushing can allow bacteria like Streptococcus pneumoniae to flourish, increasing aspiration pneumonia risk by 30% in community-dwelling older adults. Applied and Environmental Microbiology, 2019. How to clean? Brush natural teeth twice daily with a soft bristle brush and fluoride toothpaste. For dentures, remove after meals. Brush with a non-abrasive denture cleanser. Soak overnight in a mild antimicrobial solution, and rinse before reinsertion. Why it matters: reduces gum inflammation, limits oral biofilm that can migrate to the lungs, and aids proper nutrition by maintaining chewing function. Expert tip: after evening cleaning, leave dentures out overnight to allow gum tissue to breathe and repair. Inspect the mouth daily for sores or redness and report to your dentist promptly. 3. Facial and eye care, clear vision, clear comfort. The skin around our eyes and face is delicate. Seniors may accumulate oils, makeup residue, and environmental irritants that contribute to blepharitis, dry eye, and skin irritation. Research in the Journal of Ophthalmology shows that gentle eyelid hygiene reduces bacterial load and inflammation, improving tear quality and comfort. Journal of Ophthalmology, 2020. How to clean. Using lukewarm water and a soft, clean cloth, gently wipe eyelids from the inner corner outward. For stubborn debris, use a diluted baby shampoo solution. Rinse face with a mild, pH-balanced cleanser. Why it matters: prevents eyelash follicle inflammation, reduces risk of conjunctivitis, and supports clearer vision. Cleansed facial skin allows better absorption of prescribed ophthalmic ointments or eye drops. Expert tip: always use separate cloths for each eye to avoid cross-contamination. Pat skin dry, never rub to protect fragile facial tissue. For ear care, hear the world loud and clear. Earwax provides natural protection, but excessive accumulation can lead to discomfort, hearing loss, and infection. In older adults, cerumen impaction rates approach 30% and often go unaddressed. International Journal of Audiology, 2019. How to clean. Never insert cotton swabs deeply. Instead, use a soft cloth to gently wipe the outer ear and behind the ear. For mild cerumen buildup, apply a few drops of physician-approved mineral oil or glycerin to soften wax, then allow it to exit naturally. Why it matters: ensures clear hearing, a key factor for safety, communication, and cognitive stimulation. Reduces risk of ear canal inflammation and balance disturbances. Expert tip: if hearing seems impaired or there is persistent ear discomfort, seek professional removal rather than attempting aggressive self-cleaning. 5. Underarm care. Freshness that prevents infection. The underarm region can harbor sweat and bacteria, leading to odor, skin irritation, and in some cases, intertrigo, skin fold rash. Seniors with limited mobility may not dry thoroughly, increasing risk of fungal overgrowth. Clinical Dermatology Journal, 2021. How to clean. Wash underarms daily with warm water and an antibacterial, fragrance-free cleanser. Gently pat dry, ensuring no moisture remains in the fold. Consider applying a medicated or zinc-based powder if prescribed. Why it matters: maintains skin integrity, prevents odor, and reduces risk of bacterial or fungal skin infections. Expert tip: wear loose-fitting, breathable clothing to allow air circulation and reduce sweat retention. 6. Genital and perineal care. Comfort and confidence each day. The genital and perineal area is prone to moisture accumulation, especially in individuals with incontinence. Without daily cleansing, seniors risk urinary tract infections, UTIs, skin breakdown, and fungal rashes. The Journal of Urology reports that daily gentle cleansing reduces UTI incidence by 40% in older populations with incontinence. Journal of Urology, 2018. How to clean. Use warm water and a mild, pH-balanced cleanser. For women, cleanse front to back. For men, retract the foreskin gently, clean, and replace. Pat dry thoroughly, and apply a barrier cream if skin is irritated. Why it matters: prevents pathogen migration to the urethra, reduces chafing and skin breakdown, and preserves dignity and comfort. Expert tip: for caregivers assisting dependent seniors, maintain privacy, and communicate gently to uphold self-esteem. 7. Scalp and hair care. A renewed sense of well-being. Healthy hair and scalp care contribute to self-esteem and skin health. Accumulated oil, dead skin cells, and sweat can foster dandruff and itching. A trial in dermatologic therapy showed that twice-weekly gentle shampooing alleviates scalp inflammation and improves hair manageability in seniors. Dermatologic therapy, 2020. How to clean. Shampoo with a mild, sulfate-free formula 2 to 3 times per week, massaging the scalp gently to stimulate circulation. Rinse thoroughly and pat hair dry, avoid vigorous towel rubbing. Why it matters: maintains scalp health, prevents folliculitis, and enhances personal comfort and appearance. Expert tip: apply a leave-in conditioner or lightweight oil if hair is dry, focusing on ends rather than roots to avoid buildup. 8 foot and toe care, strong steps into every tomorrow. Feet bear the weight of our lives. In seniors, reduced circulation, thicker nails, and minor injuries can escalate into serious infections. According to the International Wound Journal, daily foot inspection and cleansing decrease foot ulcer and infection rates by 50% in older adults, especially those with diabetes. International Wound Journal, 2019. How to clean. Soak feet in warm, not hot, water for 5 to 10 minutes. Use a soft soap and a gentle brush to cleanse between toes. Dry completely, paying special attention to toe webs. Trim nails straight across and file edges. Why it matters: prevents fungal infections, athlete's foot, corns, calluses, and ulcers. Promotes balance and mobility. Expert tip: apply a moisturizing lotion to the tops and soles. Avoid lotion between toes to prevent excess moisture. 9 nasal and sinus care, breathing easy every day. Nasal passages trap dust, pollen, and pathogens. Age-related decline in mucociliary clearance can lead to sinus congestion and infections. A randomized trial in rhinology demonstrated that daily saline nasal irrigation reduces sinus infection episodes by 30% in seniors. Rhinology, 2021. How to clean. Use an isotonic saline spray or a neti pot with physician-recommended saline solution once daily. Lean over a sink, tilt your head, and allow the solution to flow gently through one nostril and out the other. Pat the nose dry. Why it matters: clears mucus, allergens, and bacteria, supports sense of smell, reduces respiratory infection risk. Expert tip: use distilled, sterile, or previously boiled water. Clean irrigation devices after each use and air dry to prevent microbial contamination. 10 skin folds and pressure-prone areas, gentle care for tender skin. Seniors often develop skin folds under breasts, belly, or between inner thighs. These areas can trap sweat and debris, leading to irritation, yeast infections, and pressure sores, especially in those with limited mobility. A study in the Journal of Wound Care found that daily cleansing and drying of skin folds reduced intertrigo and dermatitis by 45%. Journal of Wound Care, 2020. How to clean. Gently separate skin folds with minimal tension. Wash with warm water and a non-alkaline, pH-balanced cleanser. Rinse and pat dry completely. Apply a thin layer of barrier cream or antifungal powder if prescribed. Why it matters: prevents painful rashes, reduces infection risk, and preserves skin integrity. Expert tip: for dependent seniors, use soft, disposable cloths and ensure caregivers use clean gloves if needed to maintain hygiene standards. Conclusion: daily hygiene extends far beyond a ritual of cleanliness. It is a lifeline that supports organ function, prevents infection, and preserves independence for seniors over 65. By routinely cleansing these 10 critical areas: hands and nails, mouth and dentures, face and eyes, ears, underarms, genitals, scalp, feet, nasal passages, and skin folds. Older adults can dramatically reduce the risks of pneumonia, urinary tract infections, skin breakdown, and more. These practices, grounded in robust clinical evidence and recommended by global health authorities, empower you to take charge of your well-being. Implement these gentle, thoughtful routines, and you will not only feel refreshed each day but also invest in your longevity, vitality, and quality of life. Your path to a longer, healthier journey begins with a simple, transformative act of caring for your body, one day at a time.